Excellent. All right. Well, without further ado, I'm going to let Micah Dumont from the Tailgate Toolkit take over. Yeah, short introduction, given that I've already eaten up some of our time with technical difficulties. I will say, if you have any questions, please hold them to the end. If you're afraid at all of forgetting them, feel free to type them in the chat and we'll read them off and go through them at the end. Yeah, we'll take it from there. Thank you very much.
Perfect. Thank you so much. And thank you so much, everybody, for coming. Again, my name is Mika Dumont. And if you guys are also afraid to have any questions, feel free to email me. That's no problem at all. So this is Tailgate Toolkit. We provide free education and training about substance use within trades. It was started by VICA, so Vancouver Island Construction Association. We're funded by the Ministry of Mental Health and Addictions, and we won the 2024 Community Leader Award, and it recognizes members of the Canadian Construction Association who have devoted time and effort to the betterment of the communities. Before we go further, I do just want to show a trigger warning because we will be talking about addiction, lived experiences, and mental health. So at any point, if you feel uncomfortable or need to leave, your health matters, so it's perfectly okay. So once again, hi, I'm Mika Dumont. I used to own a construction sign company with my husband here in Kelowna. So we used to develop all these really big signs throughout Kelowna. And this is why this project means so much to me is while I was working construction, unfortunately, I did get injured while I was on the job and ended up breaking my back and I was paralyzed for 24 hours. And then after surgery and everything, my doctor right away was like, we're going to put you on fentanyl patches. It's going to be the best thing to maintain your pain. So sure, it covers up your pain, but I ended up going straight back to work and I ended up getting injured again. And now I'm permanently disabled and cannot work in construction anymore. And this is why the Tailgate Toolkit is so means so much to me is because I struggled so much with an opioid addiction at the very beginning 4 years ago that I now understand why our numbers are the way they are. So why are we here? As you know, on April 14th, 2016, the provincial health officer declared a public health emergency due to the opioid-related overdose deaths reported in BC. The drug toxicity due to the rising presence of fentanyl continues to impact communities across the province. Construction, trades, and transport workers are overrepresented among those dying. Before we go further, I like to explain that we don't use the word overdose anymore. I like to use the word drug poisoning. As I've explained before too, I present a lot at high schools and I explain an overdose is when you take an overabundance of something. What is happening now is nobody's taking an overabundance of anything. They're just, our supply is being poisoned. So what is fentanyl? It was first developed for extreme pain management treatment. It is a synthetic opioid that is 50 to 100 times stronger than morphine. It's often unknowingly consumed because you can't see it or doesn't have a smell or a taste to it. And then in 2012, fentanyl was detected in only 5% of drug poisoning cases. And since August of 2017, it's been in 85% of cases now. So this is what a lethal dose of fentanyl looks like. That little bit amount is what is in our supply, and that's why we can no longer consider it as an overdose because this is not an overabundance of anything. And it can be mixed in with other drugs as heroin, cocaine, and there's some found in counterfeit pills that are made to look like prescription opioids. Fentanyl has been on the rise, unfortunately, for a while. As we can see, it was down a little bit in 2014, and then after 2019, as we're all aware of COVID, it ended up skyrocketing. And as if we've noticed, it's hitting people between the ages of 10 to 59, and it accounts for more deaths than homicides, suicides, accidents, and natural diseases combined. Since 2016, unfortunately, we've lost over 14,000 British Columbians due to the toxic drug poisoning. Of those employed at the time of their death, the majority were in trades, transport, and forestry, representing 52%. That's a high number for this to be affecting our community. So one of the things I like to bring up is not a lot of people know this, but a private residence is a house or a hotel or somewhere you are living. So this stat shows us that this isn't affecting just the people that are living outside. This is affecting our next door neighbors. It could be the guy living upstairs from you. It could be the girl, renting her apartment underneath you. This is affecting more people inside than it is outside, which is why do we think this is happening in our industry? So when we made the Tailgate Toolkit, we wanted to go straight to the industry to see what the struggles were so we could build a better program around being able to help people. So with that, we heard self-medicating for physical pain, which I completely understand. Like I said, I got out of surgery. I think I was paralyzed for 24 hours. I waited 2 weeks to heal, and then I was like, I've got to get right back to work. I've got bills I got to pay. So there was a lot of self-medicating for physical pain. It was a very work hard, play hard culture, as a lot of us know. I know for a fact I was the same way when I was working out there. Like, even my husband was the same way. Everybody we were working around was always, they worked hard. And then as soon as our shift was done, we were all heading to the bar to have a beer together just to shoot the shit. Like, I get it. There was negative expectations of masculinity and toughness. As a woman, I saw that firsthand by walking onto a job site, and instantly you see the men puff up their chest like they need to show that, like, yeah, I'm a man. And it's sad that that's what it is, but it is. They just feel like they have to be this. So with that came a lot of lack of self-worth, preventing help seeking, because you're a tough man. We don't go ask for help. It's never the thing. My dad was the same way. He's ex-military, and even to this day, he just recently got on antidepressants, and he said he really wished that he went earlier in his years to go get help for this instead of struggling for as long as he has. The negative mental health due to stress, isolation, and personal hardship. I know one of my buddies who does a 2 weeks on, 2 weeks home, 2 weeks off kind of thing, and he finds that even the 2 weeks up there is really hard because everybody's working so hard that at the end of the day, everybody just comes home, has a beer by themselves, and then crashes. There's also stigma and judgment, as we all know. Even in today's society, we're still very much stigma and judgment towards people who are struggling. The need for employers to step in, and then employers who did not know how to help. So with that, we've learned from hearing from the industry and then reading the stats. It all just plays together with everything. So unfortunately, 62% had a diagnosis, evidence of mental health disorder. And I mean, I know for a fact I've struggled with mental health. We all know somebody, or even ourselves, have struggled with mental health. The more we talk about this, the less this number will rise. We've also had, before the time of death, there was 44.6% of people the year prior to their death for pain-related issues. I completely understand that. Everybody gets hurt at work, and our first thing is, what can we take so we can get back to work because we have bills to pay? 74% of people who died to drug poisoning are men. Why do we think this is affecting men more than females, where it's only 26% of people who died due to drug poisonings are female? As we read back from hearing from the industry, it's the stigma and judgment and the masculinity that men are having a hard time not being judged for wanting to go get help. Unfortunately, this is a huge number, as we know. 61% of people used a loan at the time of their death. I know for a fact when I was struggling, even though I have a very supportive family, we're very open, we talk about everything, it was still hard to admit that I needed help and I needed to reach out for help. And even now, I still have my days where the pain gets too bad. I'm now able to talk to people about it, but it's still really hard to open up and admit that you are struggling when you're supposed to be at the top of your game and the toughest. So let's talk a little bit about substance use so we can understand a little bit better of how things happen. It is a range of experiences. Addiction is not a choice or a moral failing. It's a treatable medical condition. It changes the brain and body, causing a person to have intense cravings for the drugs or alcohol that will be beyond their control, making it hard to stop even if somebody wants to. I know for a fact when I first got injured, I ignored it because it's what we all do. I was like, oh, it's just a sore back. We'll be fine. So at the end of the day, of course, I drank a little bit more than I should have. I'd pop a couple of extra more Tylenol before that. I would consider that still be beneficial use or lower risk use. But after my surgery and getting put onto fentanyl, and realizing how quickly you can just, the reason why it goes from lower risk use to sometimes higher risk use is because my doctor put me on my fentanyl patches. And then at the end of my 2-month prescription, he cut me off without saying anything. He's just like, nope, you're fine. You're healed now. You don't need this anymore. The withdrawals was the craziest thing I have ever gone through. And it's not something I ever want to go through again. And that's what stops me from relapsing. But a lot of people don't have that strength or that will to do it. So as soon as their doctor cuts them off, they're off to go find a buddy that's got something for them. And the problem with that is the drug poisoning that is in all of our supply right now, that your buddy that's been doing it for a couple of days or whatever has a bit of a tolerance. You don't. So the people that are unfortunately being targeted at the moment is anybody who is in the lower risk use or beneficial use, unfortunately, because of how the supply is working, that I find my friends who just like to randomly party now are the ones being affected. And with the stigma and judgment in my house, I still have house parties. I'm not gonna not have my friends over. So I let all of my friends know, listen, if you're gonna go have a solo party in the bathroom, that's fine. Just know that there's naloxone in the cupboard and you get 15 minutes in the bathroom. If you have not come out in 15 minutes, somebody's going to check on you. And that's all it takes for us to stop those numbers and stats from rising of people using alone or feeling like they have to hide it. So let's talk about harm reduction, because as we know, we use harm reduction in everyday life. So let's think about it using a car. When cars first came out, they were not the safest things. We were just like, all right, we got a motor vehicle, let's go. So after, a few failed attempts, we came out with harm reduction for cars. You have seat belts, airbags, and road signs. We reduced the harm with something dangerous. Same thing in construction. PPE hats, like PPE, like hard hats and safety glasses, fall protection, and first aid on site. That's how we are slowly reducing the harm in construction, just like cars. Sports, we now have helmets, padding. Things are a lot safer because we've reduced the harm in things. So why not reduce the harm in safer substance use? Always and forever, abstinence and non-use is always the safest route. Sometimes shit happens. I get it. Trust me, I have friends. So there is a safe site that has now come out, which is fantastic for everybody, that if you're still not, as I like to tell my friends, if you're still using, you don't want to tell your friends, go to a safe site. There's a nurse there just to make sure you're safe. Or at most safe sites now, you can actually get your drugs tested. So at least go get them tested. Know what you're using. Again, everything. You can get everything tested now. We're very open about getting our drugs tested, that it only takes a short amount of time for things to get tested. And I have a couple of friends where they plan things in advance. So you can actually mail in your samples and they'll let you know. So a couple of my friends will mail their samples in and plan like a camping trip for weeks after, being like, all right, this is safe. We're good to go. Use with friends. We saw the stat. I have friends, like I said, I've been clean now for 4.5 years, and I have friends that still use. And like I said, I'm no stigma, no judgment, 15 minutes in the bathroom, and then somebody's checking on you. There's an app for that, which is fantastic. There's an app for everything now, and I love that there's one for harm reduction. There's two great ones. So we have Brave, where you put in your coordinations and your safety plan, and you're on the phone with somebody. And well, they'll talk to you while you're using. And if for some reason you don't reply back on the phone with them, they go into your safety plan and follow the safety plan of what you would like if you have had a drug poisoning. The other one is Lifeguard. And Lifeguard just takes your GPS coordinations and you put on a 15-minute timer. And so when you're using by yourself, a timer goes off, you press snooze, and in 15 minutes it goes off again. And if you do not press the snooze button and the alarm keeps going off, it'll actually send your GPS coordinations to 911 and then hopefully paramedics come to you. If you don't like the idea of an app, once again, phone a friend. Same thing as the apps, just tell your friend what your safety plan is so they know that if you don't respond on the phone with them, they know what to do to either call 911 or they're calling your neighbor or your mom that's home or something. If you're using start low, go slow, as you've noticed, fentanyl is in the system. You're not going to see it mixed in with anything. So I like to say start low, go slow. Don't be doing some big things anymore, just small, one at a time. Obviously, you want to make sure that if all three of you are passed out, who's saving who? So one at a time to make sure everything's okay. Carry a kit always. I have a 14-year-old and a 16-year-old. My 16-year-old actually just went to a party on Halloween, and her and her boyfriend and their two friends before they left, I trained them in naloxone. And I basically said, at the end of the day, you are saving a person. It doesn't matter what put them there or why they're there, you're saving a person. And another great thing is just sign up for toxic drug alerts. They're just great to have, even if you're not using. I have friends where I just like to be like, hey, what are you guys up to this weekend? And oh, we're going here, we're going there. And I'm just like, hey, this is just what's in the supply right now. Just be careful. Take some fentanyl test strips with you wherever you're going. But if you're done with the harm reduction and you're ready for help, and I've been there where harm reduction can only help me for so far before I was like, I really need to go into the next step. So road for recovery is different for everybody. So if you're not sure what to do or where to start, you can contact your local mental health and substance use office. You can also in BC 211 for local programs and resources, I think is fantastic. And if you're really needing help, the Interior Crisis Line is fantastic. I'm not going to lie, I've called that number before, and everybody on there has been absolutely wonderful, and it was so easy for me to get help. Recovery and treatment, like I said, it's different for everybody. For me, what helped me the most when going through my pain struggles was joining a support group. So that is something we also offer, is we offer Hammer Time, which is every Thursday via Zoom, 7 to 8, and it's a support group. It's peer led, industry focused, and it's not 12 sets or abstinence based. And we wanted to make it virtual. So as we said, when we were talking to the people learning about like what's a problem, they said isolation. So this is why we made it via Zoom. So anybody up north or out in the woods or wherever, they're able to join and talk to other people that are also struggling and understand exactly what they're going through. And like I said, for me and my pain, it was so nice to actually join another support group with construction workers who also understood what you're going through. Experiencing chronic pain, I wish I knew about this one. So we've partnered with Pain BC, and they are a fantastic program. And I really wish, like I said, I knew this when I got hurt, because they will, as I like to explain it, hold your hand from the very minute you get hurt all the way until you go back onto the job site, and then continue holding your hand after to make sure that your employer is doing the right thing and that you're supported in every way possible. And I really wish I had known about this when I got hurt. It would have made filling out the papers and knowing my rights a lot easier than getting lost and confused. So when it comes to preventing and maintaining our mental health, again, these numbers are fantastic to reach out to, talk to your friends, talk to anybody. I learned the hard way that if you keep things to yourself because that's what you're supposed to do, you end up struggling a lot harder later, as I like to explain. And I've explained that to my dad also when he finally was open with me. And even he said he gets it. He's like, I struggled for a lot longer than I should have if I had just reached out for help. And I asked him what stopped him. And he said it was, he's like, I didn't think I would be a man still. He's like, but I now realize after getting help, I'm more of a man than I was before. So last thing is duty to accommodate. So substance use disorder is recognized as a medical condition, but that does not mean that you get to go to work out of your mind, you know? You have to go. When I was injured and I came back onto my job site, I told my boss what was happening and I was like, listen, I'm injured right now. My doctor has put me on fentanyl patches. I don't think I can be on a job site. He's like, not a problem. We will move and accustom your duties to something that suits you better. So I ended up doing a lot more office work, which I'm not gonna lie, fantastic. It was wintertime. I enjoyed that much better. So that's all that means. It doesn't mean that I get to go onto the job site blitzed out of my mind, being like, duty to accommodate. No, the duty to accommodate is that he changed my responsibilities to better suit what I needed at that time. And unfortunately, just as a gentle reminder before we're done, is so far in 2024, from January to July, there's already been a total of 1,749 deaths due to toxic drug poisoning in BC. In September alone, we lost 183 people, and 74% were males. This is a conversation that just needs to be had, and this is why we have Toolbox Talks, is for me to go onto job sites, have this open conversation that even if nobody talks to me after I leave the job site, I know for a fact somebody's going to start the conversation after I leave. And that's it.